All states in Malaysia except Sarawak will be under lockdown from Friday as the country struggles to control a third wave of COVID-19. More than 3,600 new infections have been recorded. Melissa Goh joins us live now. Mel, is the imposition of this lockdown considered sudden?
Well, according to Senior Minister Ismail Sabri, the number of new cases in the other states across Malaysia has increased despite the reinstatement of stricter movement restrictions or movement control order MCO on January 13 last week. Now, the 5 states, including here in Klang Valley and capital Kuala Lumpur, already under MCO. Now, Health Director General Dr. Noor Hisham, speaking at a news briefing this evening, also explained, and that's because the increased interstate travel prior to the reimposition of MCO, especially during the year-end break, now the record high in daily new cases that we're seeing still hovering above 3,000 is a result of that. Now, the surge in community spread, the worst is not over. Dr. Noor Hisham said with R0 that measures the rate of infection now at around 1.2, Malaysia will witness 5,000 new cases a day by the third week of February and 8,000 cases by third week of March. It's worrisome because the healthcare system is now already at breaking point, and also the beds in the ICU in Klang Valley are almost full. Now, over 100 patients are now intubated. Now, the number of serious cases has also increased by about 10-20%. Dr. Noor Hisham said he expects cases to stabilize in a week or two, and that's when the impact of this new MCO is starting to kick in. Now, it's daunting with the increase in new clusters. We are now entering into the second week of the MCO in KL and the 5 states, including Johor and Penang, and the rest of the 6 states, such as Kedah, Perak, and the East Coastal states, except for Sarawak, will begin their partial lockdown with stricter restrictions starting this Friday for 2 weeks.
Mel, the rise in numbers is worryingly high. How confident is the government that it can control the outbreak at this point?
You know, the country already under a state of emergency declared and reintroducing the stricter movement control order, MCO. It's a do-or-die battle. The Health Director General said it takes time. The impact of the second MCO will not be seen till later in a week or two. And the private hospitals are now helping to ease the load. The government is also hiring additional 11,000 healthcare workers to beef up the system. Testing is also a challenge because it's been slow, as well as in contact tracing. There's been a bottleneck, and the private labs are now asked to help out. It's a request for all of the society approach, all hands on deck. Now, Malaysians really need to stay at home and do their part to help flatten the curve, because Malaysians, they are not getting vaccine till early March, and the vaccination program is only scheduled to begin by the first week, and the government is only vaccinating up to 80% of the population by the first quarter of next year. So it's still a long way off. The focus right now is to bring the cases down. Now, Mr. Muhyiddin's government has extensive powers now to combat the pandemic with the declaration of emergency. The parliament is now suspended. All possible change of government is now on hold. The King has also issued a statement today asking all politicians to put aside their differences. Right now, this is not the time to politic. Again, focus on reining in the pandemic. An election, he promised, will only be held after the pandemic is addressed. To address the issue, a razor-thin majority of the government is now still ruling.